My name is Dinh. I'm a senior member services manager, and I will be talking about a couple updates in regard to Medi-Cal for the years of 2024. So basically, all of this update will implement in the years of 2024, but we just wanted to keep the update during this time just so that we have enough time to prepare. Okay, so the first thing that we wanted to talk about are changes on the Magi Medi-Cal. The Magi Medi-Cal is a Medi-Cal that focus on age, which is 65 and above, and disabled individual. So the changes for this. Basically the key change for this is the access elimination. So as we all know, or as you may have already aware, that for the longest time, one individual who's 65 and above and who have disabled, when they apply for Medi-Cal, they have to pass the access test, which is, it's used to be 2,000 per person and 3,000 per couple. However, that has already increased to 130,000 per person and 195,000 per couple as of July 2022. However, there will be another change to this resource test. So basically by January 2024, there will, they actually eliminate the access resource. So basically, whoever 65 and above and who has disabled applying for Medi-Cal, they don't need to look at their assets. So, they can have a lot of assets as long as their income is eligible, they will be eligible for full scope Medi-Cal. Another change for Medi-Cals apply to age 26 to 45 adult. So basically for this group right now, for those who for this group who's are undocumented, they are not eligible for full scope Medi-Cal. If they apply for Medi-Cal, they can only eligible for restricted Medi-Cal, meaning they can only use the Medi-Cal for life-threatening emergency, for hospital uses only. But, for regular checkup, they won't be able to use that restricted Medi-Cal. And to compensate for that, for Alameda resident, we have the program called Help Pack program where they can apply during this time. So that will cover their regulars doctor visit. However, there will be the expansion for this group who will be eligible for full scope Medi-Cal as of January 1st of next year. So basically, this group of individual who, doesn't matter their immigration status when they apply for Medi-Cal, as long as, they meet other criteria of eligibilities, they will be eligible for full scope Medi-Cal. It doesn't matter on their immigration status anymore. And during this time for Asian Health Services patients who currently have HELPAC program, during this time, we can help individual to submit the restricted Medi-Cal because as of now they can only eligible for restricted Medi-Cal, right? And the full scope Medi-Cal won't kick in until January for 2024. However, we can start submitting the restricted Medi-Cal at this point. So by next year, January 1st, the county can automatically transition into the full scope Medi-Cal, and and so then there won't be any gap, because as we know, when we're submitting the application, there will be we need to allow time for the county worker to work on the application. So do utilize or take advantage of this time, so then they can get the full scope Medi-Cals, the soonest as January for 2024. And then also during the time, when we help individual to submit restricted Medi-Cal, there's a raffle, there's a monthly raffles of $50 Target gift cards, that were provided by the social service agency. Another change will be the 2024 Medi-Cal Managed Care. So a lot of time, maybe you probably already aware that if you currently have Medi-Cal and have select Blue Cross as your health plan, you may have already received a lot of mails, notice, probably from the health plan itself telling you that Blue Cross is exiting. They no longer part of the Medi-Cal Managed Cares by next year. So what you're going to have to do, a lot of information has already been given out, or you probably have received a lot of mails already. So just wanted to take this time just so that just wanted to come first, or letting you know that you don't need to worry too much about that. So basically whoever currently have Blue Cross as a health plan, then also Alameda residents, basically you don't have to do anything. So by next year's they will automatically transfer your Blue Cross health plan into another health plan in Alameda County, which is called Alameda Alliance, keeping the same keeping the same primary provider. So basically you don't have to do anything at this point, with the condition that you are Alameda County residents. However, for those who have Blue Cross as a health plan with Contra Costa Blue Cross health plan, but lived in Contra Costa County, you may need to select whatever health plan that available at that county. So there probably won't be like automatically transfer. If they do transfer, they probably just transfer to the available health plan that available in that county. So it may not be your current existing, so they may not be able to keep your current existing primary care providers. And then another change is Kaiser will also be part of the Medi-Cal Managed Care plan. So whoever that get approved for Medi-Cal, they can select Kaiser, but with the conditions is that within the last 12 months, you must be Kaiser patients, or if any of your family member are Kaiser patient, then that's one of the criteria that Kaiser will accept you as their members, or that will be one of the criteria that you'll be able to select Kaiser as your health plan. And again, this will take effect by 2024. Another change for Medicare Advantage. So basically Medicare Advantage is applied to those who have Medicare benefit and who join to, one of the health plan. We normally call this as a Part C Medicare Advantage. And then by next year, January 1st, 2024, health plan HealthNet, it's exiting Alameda and Contra Costa County, as well as the Imperial Health Plan is also exiting Brown Tolan Network. So for Asian health patients, if you could, if you like, joining the health plan, then we have contract with other health plan that are available through Brown Tolan that you can select beside HealthNet and Imperial, or if you don't want it to, if you don't want any extra benefit provided by the health plan, then, you don't need to do anything by the end of this year. If you currently have HealthNet or Imperial by the end of this year, if you do not do anything, then, you will be going back to the original Medicare effective next year. They won't be automatically transfer you to any other available health plan at that time. But for those who, feel like the extra benefit from Medicare Advantage is helpful, it's beneficial, then we do have, we will host the 2-week sessions where we have a Medicare agents who come to our member services department and, to provide more information and, any other benefit that provide by each of the health plan. And, you can come to one of the session and see if you're interested of, changing to any others health plan that available. And then our session will be starting from November 27th through December 8th. And the time will be starting at 10. So basically the morning session is for Mandarin and Cantonese speakings. And then the afternoon session it will be for Chinese and Vietnamese, and will depending on what is the demand, and we can make like the arrangement. And do give us a call if you're interested of changing to a different health plan, but you don't know what health plan that you wanted to change to, and then you want more information about any of the health plan that you have in mind. Yeah, just come to one of the session. And however, do give us a call at 510-986-6880 so we can reserve the spot for you, during the 2-week sections. Another thing I kind of wanted to remind everybody is that this is the, right now is the open enrollment for Cover California. Open enrollment for Cover California usually run from November 1st until the end of January next year. So during the time, if you need to apply for a health plan through Cover California because your income is slightly higher than what you can eligible for Medi-Cal, do take, advantage, or do utilize this time to apply for health plan through Cover California. For those who already have Cover California, this is also a time when you wanted to renew your coverage for 2024. You wanted to do that before the end of December, so then your plan can, can take effective January for 2024. Or if you don't like, whatever plan that you currently have, this is also a good time to, switch to a different plan for the 2024. And all of this, if you've done this by the end of December, your plan will take effective January for 2024. But if you do it during the month of January, then the plan will take effective by the 1st of February. And if you miss, this open enrollment, you do have another chance where where you're gonna have to have some sort of special live event. For example, you just moved to California within the last 60 days, or if you recently married, or if you welcome a new baby, those can consider as a qualified live event where you can enroll into Cover California outside of the open enrollment window. And all of the changes and all of the update in regard to Medi-Cal's Cover California, if you have any concern, question, you can always give us a call at 510-986-6880, to get more details on any of the information that I just provided earlier. And ours, office hours run from Monday to Friday from 9 to 5. We do close for lunch from 12 to 1. So if any question, any concern at any time, just give us a call, and we're here to answer all of your questions. And that's it for me. Any questions so far in regard to any of the updates?